Trump's administration has uncovered a frightening and deadly fact: the Department of Veterans Affairs has been letting its hospitals hire doctors and nurses with revoked medical licenses. Apparently this has been happening for the past 15 years. Clearly, and for good reason, it violates federal laws. In direct contradiction to a 1999 law that bars any VI from hiring a healthcare worker whose licenses had been revoked in any state, in 2002 the VI distributed guidelines that allowed its hospitals to hire doctors and nurses that had a license in one of the 50 states, even if they had previously been subject to a license revocation. A report by USA Today starts out: veteran patients in imminent danger at VI hospital in D. C. Investigation finds. Among the findings, in February 2016, a tray used in repairing jaw fractures was removed from the hospital because of an outstanding invoice to a vendor. In April 2016, 4 prostate biopsies had to be cancelled because there were no tools to extract the tissue sample. In June 2016, the hospital found one of its surgeons had used expired equipment during a procedure in March 2017. The facility found chemical strips used to verify equipment sterilization had expired a month earlier, so tests performed on nearly 400 items were not reliable. Missel said that the practices have placed patients at unnecessary risk, though so far, the Office of Inspector General has not determined if patients were harmed. The OIG's work is continuing and will include an assessment of whether patient harm has resulted from any of these inventory practices in its final report on the medical center, he wrote. That report goes on to explain that the conditions at the Department of Veterans Affairs Medical Center in Washington, D.C. are so dangerous that the agency's chief watchdog group actually put out a report alerting patients about the issues at the organization. Apparently multiple issues were found at that location, such as lack of critical supplies, including bone material needed for knee replacement surgeries and tubes needed for kidney dialysis, due to an ineffective inventory system. Worse, perhaps, than the lack of an effective system was the fact that the Inspector General found that senior VI leaders knew about the problems for months but did nothing to rectify it. In addition to this finding, the investigators reviewed 25 sterile storage areas and found that 18 of them were dirty. These types of reports from the Inspector General are, in fact, not commonly made, with the last one having occurred in January 2015. The Washington VA's medical director, Brian Hawkins, has since been relieved of his position and placed on administrative leave. In addition to the immediate danger posed by these issues, there is the larger issue of whether or not a government-run healthcare system, as promoted by many liberals, would be able to provide quality healthcare to you as citizens. If this VA debacle is any indication, it most certainly would not. Like loading.